have a sad video today, and also may make you angry. I didn't find any blood vessel conditions that I felt comfortable putting on YouTube. Anyway, on to the video.
5. Carol is getting Ashley dressed when, to her horror, she notices an all-too-familiar bump on the left side of her daughter's back.
There was this big, huge lump, and it was just like the other side. And I immediately panicked because I thought, oh, no way, this is going to happen again.
In a state of panic, Carol rushes Ashley to the closest emergency room. But after performing a thorough exam, the on-call doctor assures the anxious mother that there's nothing to worry about.
He kept saying, there's nothing on that side. That swelling is probably due to the fact that she's overusing her left arm. When he said it was overuse, I totally believed him, and I think it's because I wanted to believe him.
Carol breathes a huge sigh of relief and takes her daughter home. Sure enough, within a week, the swelling in her left shoulder starts to go down. But just to be on the safe side, they begin bringing Ashley to pediatric orthopedist Dr. William Schmidt for routine checkups.
The Kerpeels seemed like they were coping with everything they had been through very well. Probably more than I would have.
But during the first couple of visits, Carol begins to notice an alarming new pattern of behavior.
She would run to the elevator to hit that button, and she couldn't reach that button no matter how hard she tried. I said, come on, Ashley, you can do it. Get that arm up there. And she kept saying, but I can't. It hurts. If I do that, it hurts.
After all that Ashley's been through, the Kerpeels can't bear the thought of anything else going wrong.
She demonstrated her lack of motion of one shoulder and one arm, and I just was very suspicious.
Little do the Kerpeels realize that during this seemingly routine visit, their life is about to spiral out of control again.
Yep.
Concerned by the development, Dr. Schmidt orders an x-ray of Ashley's left shoulder. And almost as soon as he sees it, he realizes that something is very wrong.
I have which revealed some calcification in the paravertebral muscles. Calcification is the laying down of calcium and bone in the muscle. Fibromatosis does not, as a rule, develop any calcification. At that point, I didn't feel the fibromatosis.
I couldn't believe he was saying this to me. We had just gotten an okay to continue with our lives.
Nope.
My first reaction is seeing that she had undergone the amputation based on the diagnosis of fibromatosis. To say I was overwhelmed was putting it mildly.
How do you like my father?
Me were very definite, but I just was hoping I might be wrong.
Yeah. Commercial, I'm gonna fast forward. Fibrodysplasia,
Just as Carol and Fred Kerpeel are
ossficians,
beginning to come to terms with their daughter Ashley's amputation, Dr. William Schmidt has uncovered new evidence that suggests the amputation may have been completely unnecessary.
The more I reviewed my findings, I've saddened for the Kerpeels and Ashley.
Dr. Schmidt is confident that a strange calcification that's developed on Ashley's spine proves that she's suffering from an extremely rare and devastating disease. He takes a deep breath and picks up the phone to tell the Kerpeels exactly what he's found.
We were getting ready for our annual Memorial Day picnic, and I was in the kitchen getting a few things, and the phone rang. And it was Dr. Schmidt. And he sounded so sad to me, and I thought, what is this about?
I told her that after reviewing all the information evaluating Ashley, I felt that she had fibrodysplasia ossficians progressiva.
Fibrodysplasia ossficians progressiva, or FOP, is one of the most disabling genetic conditions known to medicine. In healthy individuals, a genetic signal instructs the body where and when to form bone. This begins as the skeleton is formed in the embryo. In patients with FOP, the mutation of a single gene alters these instructions, triggering sporadic and unnecessary bone growth, or ossification, in muscle mass throughout the body. In essence, the patient begins growing an exoskeleton.
As the patient progresses
And
on
before you
x-ray,
ask,
one
no,
can
it's not
see the
curable.
development of bone in areas where there should
I
be
don't
no
even think
bone,
it's treatable.
in unusual areas. In looking at Ashley's x-rays, the bone was developing more progressively and certainly becoming more definite for FOP.
I never heard of this $1 million word. I had to write it down to make sure I could even spell it correctly. I asked him to explain everything to me, what I needed to know.
To begin with, Ashley first exhibited signs of the debilitating disease when she was just 2 months old. What another doctor considered cluster toes was, in fact, the initial onset of the disease.
The patient with FOP, as rule, definitely has shortening and abnormal development of the great toes in each foot.
And then over time, the disease just took on a life of its own.
As the patient develops bone in the muscles, they will develop these areas of swelling that are tender. I think at the time that she had her first symptoms in the right shoulder, that was probably her first flare-up.
He goes on to explain that the latest swelling in Ashley's left shoulder is a clear indicator that the muscles in her remaining arm are beginning to transform into bone as well.
Eventually, her body would become very rigid, and basically, they become immobile. I couldn't believe I was hearing this. It was just so unbelievable.
As the Kerpeels struggle to come to terms with a devastating diagnosis, they can't help but wonder why no other doctor was able to put the pieces of the puzzle together.
On the biopsy, fibromatosis can look a lot like FOP. So it can be a very difficult pathological diagnosis to make because it was so rare. It just was not expected.
The Kerpeels' next step is to reach out to the world's leading expert on FOP, Dr. Fred Kaplan. And their first question is one they can hardly bear to ask.
I wanted to know, did the arm come off for no reason?
The amputation was done to save her life at that point because of the enormous amount of difficulty that was encountered. I don't think that the surgeons planned to do an amputation when they took Ashley into the operating room. Nevertheless, she came out with an amputation and a catastrophic event that changed the rest of her life.
There was a misdiagnosis and there was a surgery that shouldn't have been done. And it was just absolutely devastating information to get.
Unfortunately, almost 90% of FOP patients around the world are misdiagnosed. Not only misdiagnosed, but often have dangerous, painful, unnecessary procedures that actually worsen their condition.
In fact, research has proven that any sort of trauma or invasive procedure in an FOP patient can trigger catastrophic explosions of new bone growth.
Once the bone forms, it stays there. Sometimes spontaneously, but often after minor bruises and injuries, the FOP.
Kaplan and his team have identified the gene that causes FOP.
It was a gene that encoded a switch that was involved in bone formation. Our job now is trying to understand the exact reason that the switch is behaving that way.
But as it turns out, Ashley is a survivor who has been beating the odds for almost her entire life.
From a very young age, and I never knew anything else besides having FOP.
Unfortunately, coping with her disease has often been made worse by the pain of being different.
It was very hard. Sometimes I didn't even want to go out just because I don't want people to stare at me.
A lot of kids were a little bit afraid of her because she was so different looking.
In an attempt to help their daughter fit in, the Kerpeels decide to get Ashley a prosthetic arm when she enters 2nd grade.
I wanted her to be normal, so I would send her to school in this little arm, and I felt very fulfilled because I could see a whole body.
I didn't have any muscle to operate anything, so this huge piece of plastic wrapped around the back of my neck underneath my left arm up on my chest. I went to school one day and I came off the school bus and the arm was turned around and like hanging off my back.
She'd say, "Hi, Mommy." And I'm looking at this arm behind her and all the kids are kind of, and I said, "Ashley, your arm, quick, can I bring it forward?" And she'd say, "Oh, okay." And she'd pull it forward. And I'm thinking to myself, she's wearing this arm for me, not for her. I said, "Ashley, let's throw this in the garbage." Okay.
Throughout her adolescence, Ashley does her best to lead as normal a life as possible. But the disease is slowly ravaging her fragile body.
I've had flare-ups on and off my whole life. I lost mobility in my left arm slowly. I used to reach my forehead and comb my hair, and then over time, I wasn't able to anymore.
I wish there was such a thing as a mild case of FOP, but there really isn't.
Today, Ashley is 26 years old. Her left arm is essentially frozen from the elbow up. She has limited movement in her neck, and her right hip and leg are fused in a semi-sitting position. She now wears a custom-made shoe, which helps compensate for the irregular shape of her leg.
As much as I hate FOP and what it does to our body and the pain it causes, I can't imagine my life without it. I wouldn't be who I am if I didn't have this. I can't imagine not being me.
Despite the disabling disease, Ashley lives a very active life. She works for her father at their home office, coordinating corporate conferences, and spends most of her free time volunteering. The Gerpiels
the video here.